Good morning, everybody. It's Thursday. I've got almost 11:02 now, and clearly you all got my email of or clearly remembered to look the switch time for the meeting today, and then also the room change. So if I change the meeting again, it sounds like the same thing's going to happen. Like it's going to kick me a new meeting ID because I didn't use a personal meeting ID. So I guess nuances of Zoom for me to learn. Um, so let's start. Hopefully some of you guys got to watch the Borough address yesterday. I missed that as I was seeing patients yesterday, and then of course the update on the state last night. I'm on my Borough physician call, so I didn't see that, but what I did see, I checked the state site this morning, and hopefully you guys got to see it. There were 2 cases in the last 24 hours, 337 total cases thus far in the state, and of those 209 are recovered. I saw that there were maybe a combination of 41 people hospitalized or under investigation. So I would say that looks pretty good. I wanted to, and I'm going to try to share again my screen because I want to point out one thing that I thought, and hopefully you guys have all seen this. If we go to the, hopefully you guys can see my screen, I presume. This is basically the coronavirus response page. And, so this is where I am able to see really, there's the state, this is the new cases yesterday, and I don't know, non-resident, I haven't seen all that. Total cases is 337. This was the recovered of 209. Hospitalizations, 36. Interestingly, I haven't asked any questions about this, but it'd be really neat to see, like, to me, it'd be more helpful to know what's current versus, okay. It's interesting that total hospitalizations is 36. To me, it'd be more interesting to see like how many people are currently in the hospital. To me, 9 deaths thus far, and then basically it goes over, what is our capacity? We clearly have enough capacity based on current numbers right now. And then modeling, hopefully you guys have seen some of this. This is quite interesting. And to one of the questions I've been asked via chat already this morning is kind of these restrictions that are loosening. So they're looking at this epidemiology curve. And so we can see that really we're on decline. This is projected cumulative cases, and kind of what the projection would be. This is kind of what's happening. So that's how they're kind of looking at all of these things, which I think is really interesting, and I think gives us some insight, because I know certainly a lot of people have questions about why why are we doing some of these loosening of restrictions, how do we do it, all of that stuff. And I think really a lot of this has been, number one, trying to figure out what is the nature of the virus, how is it acting, how is it impacting different people. And I think that that's really important. The other thing is what is our healthcare capacity? And so clearly this time we've been able to really build up our actual capacity, which is really nice, because then if say we do get a sudden increase in numbers, at least we know, like, we have hospital beds, we have providers, we have the services we need, and so that's super important. The question is always testing, and again, now they've eased up testing, basically criteria. The guidelines now really, I would say what the state is saying the guidelines are is pretty much anything. If you have fever, cough, shortness of breath, or difficulty breathing, any of those things, you should be able to get tested, and they're actually encourage you to get tested. If you have two of either chills, decreased smell or taste, a rash, runny nose, diarrhea, rigor, sputum, muscle or joint aches, which they're saying if you have any two of those, you can get tested. I'm happy to talk to anybody about whether you want to consider getting tested or not. The interesting thing with these, what I would call secondary characteristics or symptoms that they're classifying, part of the issue is like, man, anybody with allergies, which we'll talk about, could have any of those symptoms, just about anything. And certainly, like, boy, if you ended up with, you ate something bad and you have GI distress, like that could give you a fever and diarrhea. So, I'm happy. I'm happy to talk with anybody about it because I think it just is. It's difficult to know what to do right now, and if I get on the phone with you, we'll have a very frank conversation about what's the likelihood. Do you want to get tested? Do we think you should? And so that's kind of where we're at with that. The other issue with that caveat of saying, oh, everybody should go get tested, is that we still are dealing with the fact that we have a limited number of tests and somewhat limited testing capacity. The state lab has increased their capacity more, but even with, right now, Capstone has been doing 20 to 30 tests a day. They have a 1.9% positivity rate. They had done maybe 160 tests as of yesterday, if I heard that right last night. Eventually, when they get the cartridges for their point of care machine, they will be able to do 4 tests at a time with a turnaround of about 45 minutes. And the caveat with that testing is that it has a poor sensitivity. So if you don't have symptoms, it's not going to be very helpful. And that kind of leads into questions that I've been asked already about rolling things out. So many of you are aware, tomorrow, restaurants can go to 25% capacity if they have the space available. Beauty shops, barbers, that kind of stuff can open again. And I think we're waiting. Massage, a lot of the massage therapists I know are waiting to see basically what their board kind of advises as to what to do and how to do things. Spas can be open again tomorrow, so we'll kind of see what happens. I know certainly for surgeries where the restrictions are lessening a bit in terms of elective surgeries, or maybe whatever is not, urgent surgeries have happened. If you had an appendicitis, you would, surgery would happen. Or if you had acute cholecystitis or a gallbladder attack and infection, your surgery would happen already. But now we're talking about like some of the knee things, breast issues, like if you need a biopsy, because for a while there, a month there, we were kind of like, well, if it's not going to change your, immediately impact your life within the next 2 months, it was postponed. So now that's what we're kind of rolling back. But one of the concerns, and the same thing is happening with the dental industry, and certainly because they're, you're very close in dentist, and you're also, that's where the respiratory and droplets are definitely an issue. But now they're requiring a negative test within 48 hours pre a surgery or dentistry or those kind of things. And so right now we're trying to work through how do you navigate that 48 hours. And so I think, we have a bit of a plan, but we don't have like quite all the steps in place. So I think that we'll just see what happens in the next week or two. We're going to be able to keep an eye on those statistics and watch. like all of a sudden, do we really take an uptick and go up? That probably obviously be problematic, or do we continue along like this? So time is going to tell us that. The other thing that was brought up again yesterday is antibody testing. We don't have antibody testing widely available at this point. There's concern about it cross-reacting with any other coronavirus, which is basically a common cold virus. And the other questions which we've discussed before here are, number one, will you develop an antibody response? Some do, some don't. Does that antibody response infer that you have immunity? We don't know that yet. And there's question about immunity being short-lived. So there's a lot of questions around antibodies, although we keep hearing in mainstream media and even in our state addresses, I think that we're talking about like, well, we need a vaccine or we need antibody testing and all this stuff. And I would just say we have we still have a lot of unknowns. The one thing we do know, and we're starting to see more of in the media, is we know that diet and nutrition can play a big role in this. And so we know that people with low vitamin D statistically are doing worse. So there's things we can do. And I think that's what we need to focus on is, eating well, managing our stress, making sure we're getting sleep, making sure that we're taking vitamin D, taking extra vitamin C is going to be helpful. So all of those things I think are really helpful. Another question I have here, face coverings out in public. I think right now while we're opening things back up and rolling back, absolutely. Right now, I would say you don't need a surgical mask, but having a face covering in public, I think is a good idea. I don't know, we know if, say I don't feel good and I go into a store, it would make sense for me to wear a mask so that I won't spread it to you. Again, the mask isn't going to protect, it doesn't protect me, but it will protect you from me. And so I think right now when we're going through this, wearing a mask when you're in public, that being said, if I go out for a run, I go out for a bike ride, I'm doing those things, going for a walk, I'm generally not wearing a mask. Whether that's right or wrong, I don't know. I try to start on my bike. It's been cool enough that I have one of those neck gaiters, but inevitably every single time I've been out so far, I've gotten too hot and I have to take it off, or it's down on my neck or something. So I think long-term, will we be wearing face masks all the time? I don't think so. I don't know. I mean, I would even say, we always look to the Asian countries about face masks, but they don't always wear face masks. They wear face masks when they don't feel well, so that they theoretically won't spread whatever they have to somebody else. So I think that that's actually a really good idea. Another question is getting people exposed. Eventually most of us will get exposed to this virus, and this idea of hunkering down or sheltering in place, whatever term we want to use, physical distancing. The whole idea was for us to slow that logarithmic curve down so that we could build up all of our, our capacity, and really our healthcare capacity, so that things level out. So yeah, I mean, I think we have to look at places that are more crowded, New York, unfortunately for New Orleans, there was a big spread, I think, during Mardi Gras, Florida, lots of big cities where you can't really go out and have 6 feet of space around you, because they're crowded, So I think we've seen places where it's just people have been exposed, and then when systems get overwhelmed, that's when, number one, people with COVID or coronavirus, if you get COVID-19, and if you need the hospital, we have you in the hospital, much less anybody else who has normal things that they end up in a hospital for. Somebody has a heart attack, if somebody ends up with a lung infection, if somebody needs a surgery, you know, the problem is we're adding too many people all at once. And so I think then we end up with people that we end up with poor outcomes just because we have so many people all at once. So I think most people understand the idea of why we wanted to slow down the spread. So that's, let's see any other questions right now.